Katie was saying, my name's Jordyn. I'm a third-year medical student at the University of Minnesota. I did my first 2 years of medical school in Duluth and then kind of transitions to the cities after I'm done with this program. I did college in Duluth at the University of Minnesota there, but I'm originally from Pine Island, Minnesota, which is kind of down by Rochester, if anybody knows where that is. Some of my interests are adult medicine and women's health, future planning, and going into internal medicine, which is essentially adult medicine. All right, so some of my objectives for this talk is just to kind of gain a knowledge on current screenings and vaccination recommendations, especially for kind of the group of 40 plus years of age. And then to know appropriate dosages of some common vitamins that you guys probably run into all the time. And then just to know the sources of where to find that information. So when I'm done and you don't remember anything, you'll hopefully remember some of the sources. So just starting out with some of the cancer screening guidelines. Just in general, the most common cause of cancer deaths, number 1 is lung cancer. Number 2, breast in women and prostate in men. And then 3rd is colorectal cancer. And then the most common, and this is not including skin cancers, by the way, the most common is breast and prostate cancer, then lung cancer, and then colorectal cancer. Just so you guys know how kind of prevalent this is. So I'm going to start with some breast cancer. So 1 in 8 women are diagnosed with breast cancer in their lives. And about 75% of those women do not have any of the known risk factors, so haven't had a family member with them, don't have a genetic mutation, that kind of thing. And then 25% of those are actually diagnosed in their 40s, which is kind of surprising. And then the good news is that if it's found early, almost 100% of them can be cured, which is good news. So the screening recommendations kind of depend on where you look. It's kind of a controversial of what age to start at. So the United States Preventive Task Force kind of recommends ages 50 to 75, starting there and receiving mammograms every 2 years. And then starting before 50, you can talk to your provider and kind of make a personal decision if you think it's worth it for you to start before 50. So if you had a relative that was diagnosed rather young, that might be something to think about. And then the American Cancer Society kind of starts it a little earlier at age 45, and then to 54 would be an annual mammogram, and then at 55 you start going every other year to agree with the top statement. And like I said, the life risk is 1 in 8 for your average woman. This is kind of a plug. I was told to put this in because they now have a new 3D mammography. I'm told it's coming this month, if not here already, and then they just have to run some testing and do paperwork essentially until it gets up and running. So hopefully sometime this summer that'll be available. And 3D mammography is pretty cool. So if you've ever been told that you have like dense breasts, this machine will hopefully be able to read it better. And they've had really good success with detecting cancers earlier and more frequently. So it's a good addition to the mammography screening. Prostate cancer screening is a little more controversial, as you guys have probably been aware of, just going to the doctor. But kind of recommendations are just to start a discussion with your doctor about when you turn age 55 is usually the regular age, but obviously younger if you have other risk factors. So if your dad or your brother has prostate cancer, that might be something to start thinking about earlier than the usual. And that is just a blood test. So that's the PSA testing that you might hear about. Lung cancer screening, so I would say this is probably more new than the other ones. But now we're recommending a low-dose CT scan every year for patients who have the risk factors. So that would be starting at age 55. If you've had 30 years of smoking a pack a day, it's recommended that you would get this low-dose CT scan. And then if you've quit within the past 15 years and you also had this history, it would be recommended as well. And then at any time, if you choose not to do it, you don't have to. But it actually has been proven to be more successful than like a screening mammography at catching cancers. Colon cancer screening. So this one I'm a big believer in, I would say, but it's starting at age 50 for your average risk, and then every 10 years is kind of the maximum that you can go. Obviously sooner if they find something when you're screening. And then they recommend going until about age 75 to 80, depending on kind of what your life is like. If you think you're going to be around for the next 10 years, it might be beneficial to keep going. And so we have multiple screening tools. Some are kind of new within the last few years. So the gold standard, I would say, is the colonoscopy. And if any of you have not had a colonoscopy before, you may have heard horror stories about the prep that goes into it the night before, but I assure you the day of the procedure is not bad. You really don't remember a lot, and it takes less than an hour to do. But this is really the gold standard because you can see if you have a polyp or a tumor, and then remove it while you're there if possible. Which is why if you're clean, you can go for a maximum of 10 years. So the flexible sigmoidoscopy, that is similar to the colonoscopy, it just doesn't go as far up into your colon. So that would go to approximately a third or a half of your colon. So that's maximum time is 5 years. And then the Cologuard, which is kind of the new technology on the block, is a stool sample. So they send you a box and you have like a piece of your stool and you send it off, and they do genetic testing on that and look for any DNA from cancer, essentially. And if they find anything, then they recommend you get a follow-up screening tool. So either the colonoscopy or the other one. And that, if you're clear, it's every 3 years. So it's a little, obviously less invasive, but you have to do it more often. So it's really kind of a personal choice on what you guys want. Skin cancer screening. So there's not really good evidence to show going in every year and having a full skin exam is beneficial if you've never had skin cancer diagnosed before. But the best tool is kind of to know your skin and know what your moles look like now, and if they're starting to change, to come into the doctor. And a biopsy is pretty easy to do. So if you have questions about it, always bring it into your doctor and they'll be happy to look at it for you. I just kind of put some of the 3 skin cancers on here. So this one is a melanoma, which is kind of like the scary one that everyone has heard of. Really the characteristics, just like changing colors, growing, just kind of looking really different, is kind of the melanoma feel. The middle one is called a squamous cell cancer, and this one is kind of difficult to distinguish from other lesions on your skin. So you may have something where you pick at it and it doesn't really go away, or it looks like a scab and still doesn't go away. So that would be something to come in and just have your doctor look at, and they can always biopsy it and see. And then the last one on the right there is a basal cell cancer, which is the most common. A lot of people find them on their faces or upper extremities. But the last 2, very, very rarely would they spread anywhere in your body, as opposed to the melanoma, which you've heard of kind of going all over. So just something to be aware of, and just whenever you have questions, just bring it in your doctor and they'll be happy to look at it. Cervical cancer screening. So the pap smears, you start at age 21. That's kind of changed a bit from the past, but now it's pretty confidently 21. And then for the first 8 to 9 years, you're doing it every 3 years, and that's without what they call HPV testing. HPV is a virus that you guys have possibly heard of, but it's a sexually transmitted virus, but it's actually the most common. If you qualify it as an STD, it'd be the most common. A lot of people have it, they don't know it because it's asymptomatic until it starts causing symptoms that look like cancer. So as soon as you get to the age of 30, you start testing that HPV with your pap smears, and then you can change the duration to 5 years. And most of that is because when you're in your 20s, the majority of patients, if they have HPV, your body will clear it at that point. But then as you get older, it's kind of less likely that your body will clear that virus and that more of an aggressive take on it. And I just wanted to put a blurb in here. If you are told that you have like an irregular pap smear or things aren't looking great and they want you to come back in, please do it, because there's a lot of preventable things that you can do that the gynecologists usually take care of. But it's very preventable, so I just wanted to put that in. Osteoporosis screening, they have a bone DEXA screening, which I'm sure a lot of you have heard of, but it just essentially looks at the density or the strength of your bones and compares it to what they consider a standard 65-year-old. And this, like, the density of your bones start to decrease by age 30, so it's kind of, unfortunately, a downhill slope after that. And you can be either osteopenic or osteoporotic. Osteoporotic being the one that you're really at risk for falls, and osteopenia being the precursor to that. And then starting at age 65 for women, or sooner if you have fallen or you have an unexplained fracture, basically, and that's all recommended. Some risk factors for osteoporosis: if you're low weight, so this is the one time being maybe more skinny is not beneficial. Cigarette use, definitely. The Caucasian race has a increased prevalence of this. Obviously, if you've had a fracture in the last 5 years, so if you fall and break your hip or if you broke your arm, that would also put you at increased risk for this disease. And family history is a really big one. So if your mom fell and broke her hip or whatnot, that's really important to know. And for males, it's kind of here and there, not really enough evidence to show that screening for men that have not had like a previous fracture or family history, that it would be beneficial for them. So diabetes screening has become more and more common. So it's thought that almost half of the baby boomer generation will have diabetes at some point in their life. So we really take screening for this seriously because it can have a lot of adverse outcomes if we don't catch it. So if you don't have any risk factors, so saying you're normal weight, no family history, all that, we usually start at age 45, and that's for both males and females. But you can obviously start a lot earlier than that if you have risk factors, such as if you have high blood pressure, if you have family history of diabetes, if you're overweight or obese. Those would all be considered kind of precursors, probably isn't the right word, but things that put you more at risk for getting diabetes in the future. And there's 3 different ways to look at diabetes screening. So you could get just a regular glucose at the office after you haven't eaten for 6 to 8 hours. There's the A1C, which looks at averages in a 3-month span. So that one's not really dependent on what you ate the last day or 2, but more so the average. And then less commonly is glucose tolerance test, which is used mostly in pregnancy, but you essentially take a big gulp of glucose and then they test you a couple hours later to see how your body deals with that. Cholesterol screening. So high cholesterol is kind of one of the main risk factors for heart disease in the population. And a lot of times people don't know if you have high cholesterol because you can't feel it. You don't know that it's happening. And so a lot of times we like to screen for that before it becomes problematic. So before you get a heart attack or before you have a stroke. So they can cause heart disease, peripheral vascular disease. So if your legs aren't getting enough blood flow, they start to cramp up, and we don't like that to happen. And erectile dysfunction can also be caused by a buildup of cholesterol. In males, we start screening at age 35, and that's for asymptomatic men. And then earlier if you have an increased risk for heart disease. So if you have diabetes, if you have high blood pressure, family history, those would all be kind of red flags for us to start screening a little earlier. And then in females, you start at age 45, mostly because the estrogen is thought to be protective in the female, so we start a little later. And then obviously can screen earlier if high risk. So one of the things I like to talk about is heart disease prevention, because it is, depending on what year you look, the most common leading cause of death in elderly, between that and cancer. So the most important thing you can do to prevent heart disease is just having a healthy lifestyle and eating the right foods. So low foods is in low carbohydrates, and most of that is to prevent diabetes, which in itself is a huge risk factor for heart disease. And then diet changes, mostly less red meat and more lean meats, so more chicken, turkey, fish are really good ones. And then some sort of cardiovascular exercise, so either running or walking. The pool here, I heard, is great. So doing anything in the pool builds up your resistance and your heart health, essentially. And then I've heard pickleball is kind of a big thing in this community. I don't know, but that's also a great way to get some activity, which I just learned about when I moved here. I had no idea what it was, but it sounds pretty cool. So the ASCVD, doctors talk about a lot during office visits, and a lot of you probably don't know what it is, because it's just kind of 5 letters that don't make any sense. But it's the atherosclerotic cardiovascular disease scale, and it essentially tells you what your 10-year risk of having a heart attack or a stroke would be. And then people with a score of 7.5% or higher, so you have a 7.5 chance of having a heart disease or stroke in the next 10 years, are recommended to have a cholesterol-lowering agent. So these are most commonly like your statins. So your Lipitor or your Crestor would be considered some of those. So it takes into account like your sex, your age, race, whether you're on blood pressure medications, what your last blood pressure reading was, cholesterol, if you smoke or not, and if you use aspirin or not. So a lot of these things are not modifiable, so you obviously don't have any control over what your age is. But some of these are, so making sure that your blood pressure is under control is a huge factor. Quitting smoking is obviously a great way to improve your health. And then a lot of people really benefit from an aspirin use daily. But I would recommend you talk to your doctor before starting those. So now kind of moving into more of the vaccinations for kind of the 50 and older crowd. So the shingles vaccine, kind of exciting for the medical world, probably not so much for you guys, but there is a new vaccination, came out like within the last couple months, but it's thought to be as effective almost 90% of the time, which is awesome, because the previous shingles vaccine was probably 60 to 70% at preventing that, so it's pretty exciting. And this new vaccine you can start as early as age 50, as the other one was age 60. So covering more people and being more effective. So we're pretty excited about that. So we have it in the clinics, but it's something to ask about. If you've had the old shingles vaccine, you're still able to get the new one. And it is recommended that you get the new one if you already had the previous one. So there's 2 kind of types of vaccinations for pneumonia. They kind of come in like a sequence. So Prevnar, which is the newer pneumonia vaccine, we usually recommend starting with this one, and usually at age 65 if you're healthy, or earlier if you have chronic conditions. So if you have any lung diseases, this would be a really good idea to get early, just because pneumonia is so prevalent in the United States in general. And it's still one of the leading causes of hospital admissions in the United States. And then the pneumococcal is kind of a more broad vaccine, but it's been around for a while, and that's usually given about a year after the Prevnar, and that's mostly because Medicare pays for a year after. So it's recommended that you get both, because it's kind of a series. So tetanus, so they have 2 subsets. So the Tdap, which most of you have probably heard of, has the tetanus, diphtheria, and pertussis vaccines all in one. And this is kind of recommended at least once in your adult life, if not more. Definitely if you have younger kids, or if you're around your grandkids that are babies and vulnerable, you can always get a booster of that to kind of protect more against the pertussis side of things. And then the TD is just the tetanus part of it. And you can get that every 10 years after. So some vitamins and supplements, so I kind of just picked a couple of the really common ones. So calcium and vitamin D, obviously important for strong bones and preventing fractures and osteoporosis. Vitamin D is used in your gut, and it helps absorb that calcium that you're eating or drinking. So for calcium, it's recommended to have 1,200 milligrams for women, and then 1,000 milligrams for men, but increasing the dose as they get older, essentially. So they're equal after age 70. And then vitamin D, it's recommended to get about 600 units a day. Obviously, this can change depending on where you're starting at. The best source of vitamin D is obviously the sun, which is only great about 3 to 4 months a year. So when it is out, make sure you take advantage, but use sunscreen. And then some fortified dairy products. Some of the fish can also have good vitamin D. And then calcium, obviously any dairy products have a lot of calcium in them. As for most things, getting them from your diet is more recommended than taking supplements. So if you know for a fact that you're getting these in your diet, there's really no need to supplement with them. Unless for some reason you're not, then it might be worth picking up some supplements. Iron. So this is necessary for building hemoglobin, which carries the oxygen in your blood. Obviously pretty important. The recommended dose is 8 milligrams per day. Although this is kind of a big one where we, as like a medical community, would rather have you come in and have your iron checked if you're feeling like pretty fatigued or if you have like bloody stools or anything like that, because it's pretty important that we figure out why you're iron deficient, essentially. So before you start taking anything, make sure you have it tested and we figure out why that's happening. And I wouldn't say a majority, but most of the time, you can kind of have it modified in your diet. But we just want to make sure nothing serious is going on with that. So try not to supplement unless your doctor tells you to, essentially. And then some extras. So these are some common things that I've heard in the clinic since I've been working. So the chondroitin sulfate and the glucosamine are both kind of used for arthritis. Both are safe, don't have a lot of side effects, but the benefit of them is kind of up in the air. So maybe about a 10% improvement, but it takes a while to work. And at that point, it's pretty hard to know if that's what's actually working or if you're just kind of being more active or getting the condition under control by yourself. So obviously there's not a big harm in using them, but just so you know, it's not the end-all be-all for arthritis. And I was actually talking to a few doctors around the clinic, and they wanted to make sure that I put this in here, that to make sure to tell your doctor if you're taking anything over the counter, if you're taking any like herbal supplements, essential oils, anything like that, to have them be aware of that, because there are a lot of medications that interfere with that. And that just has to do with how it gets metabolized in your body. Obviously, St. John's wort is a big one. That kind of so many medications that it interacts with. So make sure to tell them if you're on that for sure. And a lot of these, obviously Coumadin or warfarin for blood thinners, that interacts with a large amount of things, medications and supplements. So just be cautious if you're taking some of these medications. And then again, make sure to tell your doctor. Some of the conclusions I wanted to kind of take away is just make sure to talk with your doctor for screening recommendations and what is right for you personally. Obviously, we're not all statistics, and we have to kind of take it at a personal level. So what you feel comfortable with and what your doctor feels comfortable with is important. And then vaccination requirements, they change every year, almost every year. So it's just important to kind of keep up to date with them, make sure you're best protected against disease as you can be. And then, like I said, make sure to tell your doctor all the supplements and herbs that you are taking. So sources, these are very good sources to go if you guys have additional questions about what I talked about. The U.S. Preventive Task Force has a lot of screening recommendations, and they usually update every couple years. And it also gives you kind of where they're giving their data, so you can look into it more if that's what you want to do. And then the CDC vaccine schedule gets updated every year as well, so that's another good resource to have. But those are some useful sources that I found. Thank you.
Thank you.
Thanks.